Hi, I'm Jen Kay, and I'm here today at the Arizona Natural Health Center in Tempe, Arizona. I am so excited and honored to be hosting this segment of natural remedies for common and sometimes not so common conditions. So today's segment focuses on back pain, which we all have, and how this common condition can be treated actually using acupuncture. I'd like to introduce you today to Mr. Craig Amrine, who's here at the Arizona Natural Health Center and treats patients who suffer from back pain. Mr. Amrine, welcome.
Thank you. It's good to be here.
Good to have you here. So let's talk for a minute. Everybody has back pain. You know, I mean, we hear it all the time, different types of back pain, and at some point in our lifetime, right? Some days more so than others. Can you share a little bit about what some of the common back injuries are?
Well, a lot of the reasons for back pain, some of the more common sources for pain can range from just low back stiffness. We wake up in the morning, we're reached and grab, and as the day goes on, it gets better. So we just basically have that low back pain. That could be due to anything from osteoarthritis, which is a lack of cartilage. It wears down and it dries out as we get older. Other sources of back pain include disc herniations, where the cartilage between the discs, it actually blows out. As we get older, it dries out, becomes brittle, and can actually tear and cause pain or pressure on the nerve root, and that will ultimately lead to back pain. Other sources for back pain include just muscle pulls, muscle tears, ligament tears, all in that area. And probably the most common that you hear is sciatica. Everyone's saying, oh, I got sciatica. And sciatica just refers to pain along the nerve that travels from the low back down the rump and innervates the entire leg.
So with some of those things, can they be exacerbated by poor posture, sitting all the time? You know, can any of it be exacerbated by those types of common conditions?
Yeah, actually, the whole reason we have back pain is, and why it is so common, is there's two reasons that I like to give. The first is, if you look at the spine, if you look at any map of the spine, you'll see that it's comprised of tons of little bones called vertebrae. Right, and the fact that you have such a large concentration of bones in such a concentrated area, and connected to each of those bones is ligaments, is cartilage, is muscles. Each attachment point is a source for pain, is a source for potential injury. So when you have that many in such a small area, there's a good chance that sooner or later, one of those is going to malfunction. And the other reason that that back pain is so common is because we're not designed to sit. Okay, but since we're 5 years old onward, we're told to sit down, hold still for at least 8 hours a day. So from 5 years old and usually into our adult life with our working, with our career. Since we're not designed to sit, the muscles around the low back especially will atrophy, they weaken. Okay, and what happens with that, it just makes us more vulnerable to any damage that goes in that area.
So, okay. That being said, someone's, whether they're sitting or work or what have you, but they're experiencing that type of back pain, right? What are some of the ways that they can treat that, regardless of where it's at?
Yeah, the most people, when they think of back pain, the first thing that they go to is their physician, and based on the severity, well, they first try painkillers. Okay, and it can be anything from your basic over-the-counter medication to something stronger, a stronger narcotic. If that doesn't work, well, then the doctors will often prescribe cortisone, which is basically, we call it an immunosuppressor, which means it's an anti-inflammatory. So the problem that all of these, and then ultimately there's surgery that will ultimately go. A lot of surgeons now will try to minimize the chance for surgery and make sure they exhaust all of these other options before they go to surgery. So, but every one of these options that I talked about all have side effects, all negative side effects. And the doctors that will prescribe these procedures will almost always guarantee that, well, we're not sure if this is going to work. Okay, there's only a limited chance that this is going to work.
So the conventional approach then to back pain sounds like has some limitations. While you might address the symptom momentarily, that there's not sort of a fuller understanding of what that means and how it's going to work in the long term. Is that correct?
That's correct. Yeah, there are attempts and say, well, if this doesn't work, we're going to try this. Ultimately, it's drugs, and then surgery are the options. And even at the surgery, there's a lot of studies, even listed in Newsweek, they talk about that only about 50% of surgeries result in alleviation of back pain.
Wow, only 50% of surgeries result in the alleviation.
That's based on some of the studies that I've read.
Fair enough. Yeah. So the truth is, though, here at the Arizona Natural Health Center, you have a very different approach with acupuncture, correct?
Yeah, that's correct.
Would you be willing to share with me a little more about what your approach is and how acupuncture can help with back pain?
Absolutely. Acupuncture works several ways. First of all, we can alleviate pain. We know that acupuncture is proven to release what we call beta endorphins in the body. And beta endorphins are considered the body's natural painkillers. We also know that acupuncture is good for reducing inflammation. Okay? And then ultimately we can help reduce spasming, which is another source of back pain. Acupuncture in one fell swoop can do all three of these things with essentially zero side effects. The only side effects that we typically see are a euphoric, relaxed feeling that the patient has after the treatment. So, and we like those kind of side effects.
Yeah, that's a pretty good side effect. That's fascinating.
Once some of those things enact, the body relaxes, the muscles relax, circulation increases, and ultimately the rate at which healing happens also increases.
So I happen to know from personal experience, I've had the pleasure of working with you and without a doubt experiencing some phenomenal pain management results from your acupuncture treatments.
Thank you.
But I know one of the things that a lot of people wonder about acupuncture is, don't the needles hurt and does it really work?
Yeah, and that's always a question I get from my patients.
Sure.
And a lot of times that's what prevents people coming in because of the terror that they have of needles. Unfortunately, their first experience with needles is in a hospital with a needle that is about this long.
That's true.
And fortunately, the acupuncture needles that we use are very, very small. They're very thin, and most of the time, patients don't feel them.
Is that why it doesn't hurt? Because I was terrified of needles before I tried acupuncture.
Probably, yeah.
Okay, thanks.
The needles are very, very, very small, and usually I'll tell patients that you may feel a mild sensation, a mild prick. After that, the pain goes away. And the biggest sensation that they will feel is it feels weird. And weird is okay. We like weird. Okay, shows that something's happening. And as far as does it work, yes, I can say unequivocally that it does. A lot of my patients will come to me and admit after the first treatment, they'll say, Craig, I came in here very, very skeptical. I get people in the Western medical community coming to see me. I just saw the dean of nursing at a local medical college come to see me for back pain.
Perfect.
He was giggling when he was off the table. He sent me several emails saying how wonderfully he felt after the treatment. So yes, it does work. There's so many clinical trials to outline that back pain is an effective, it is a disease that we can treat with acupuncture. It's
Sure.
recognized by the World Health Organization.
Well, and
also.
I think the success story you just shared is so powerful, and I'm sure you have a list of success stories that you could share with us, the rest of the day
Yes,
about,
I can.
What your patients have experienced as far as acupuncture with back pain and the alleviation of those results. Probably my biggest question is, okay, so if I'm suffering from back pain or someone I care about is suffering from back pain, is it as simple as making an appointment to see you here at the Arizona Natural Health Center?
Absolutely, yeah. You call Tammy at our front desk and make an appointment with me, and we'll get you in. Some patients are concerned with, well, I need to get my MRIs first, or I need to get my X-rays first, and I'll be honest with you, it's not going to change my course of treatment. So as soon as you experience this pain, come in to see me. It's not going to change my course. We're going to do our best to make you feel better. If you have to wait for analysis or some other kind of treatment.
Change their ow to
Exactly.
Yeah.
Exactly.
Would you be willing to share maybe a couple tips and techniques that people could use at home, either to alleviate back pain or to help with some of those symptoms when they do come up?
Absolutely. As I said before, a lot of the reason we have back pain is because, one, we're sitting all the time, okay? And the muscles and the ligaments back in the low back will get weak. So the first thing we can do is to start strengthening those muscles. And that can be through lots of types of exercise, especially like yoga or Pilates, anything that focuses on developing the core. The ab work, sit-ups to start with, but anything that comprehensively works this whole midsection here. And then ultimately, while you're building up strength, you can also work on some kinds of stretchings that open up the hip, open up the back, and open up the abs. And again, you go back to the all-body exercise, things like yoga. That seems to work very well. And then other things, once they have experienced the pain, is, let's say they, for example, they were told they have a slip disc or herniated disc. What can they do at home while they're not being treated by me? Inversion therapy is great, where we give a slight negative traction. You don't have to hang completely by your ankles upside down. Yeah, it's not a torture device. All you have to do is hang it at like a 45-degree angle or greater in a negative way, and it just helps relieve some of that pressure on the back, and it ultimately can urge some of those vertebrae or their cartilage to go back into place. So all of these things can be done at home. And,
That's fantastic.
And meanwhile, they come to see me.
Well, thank you so much.
You're
I know
welcome.
I've learned a lot. I continue to learn from you and the rest of the doctors here at the Arizona Natural Health Center. Thank you so much. I know you're busy, and certainly you have a special expertise in being able to speak about, back pain. I know that you are a practitioner of yoga. You're a martial artist. You do all sorts of things, jumping out of airplanes and skydiving, and
I treat a lot of damaged people from all these sports, so that's why I
Sure.
get exposed to a lot of injuries from extreme sports. And so a lot of the stories and testimonials I get are from either professional fighters or professional skydivers or yoga teachers who have been incapacitated from these back injuries, and my goal is to get them back up to doing their thing as quick as I can.
fantastic. I know they appreciate it.
Yeah,
I know
thank
I
you.
sure did. Thank you so much for being here
My
today.
pleasure. Thank
Appreciate
you.
it. I sure hope that you have enjoyed this segment of Natural Remedies for Common and Uncommon Conditions. I know I've learned a lot of information about back pain and how to treat it, and hope you have too. I strongly encourage you to go online and watch our other videos in the series so that you can learn more about how natural remedies can be of benefit to you. I'm Jen Kay, and on behalf of myself and the doctors here at the Arizona Natural Health Center, we thank you for watching and look forward to seeing you soon.